have a pillow called the neck pillow. Number 2, a lot of people snore, and it isn't such a problem for the people themselves who snore, but many of us lose a good night's sleep having to listen to the person who snores. So today I'd like to just tell you a little bit about the neck pillow for people who suffer from neck pain, and about our new pillow called Silent Sleeper, the anti-snore pillow, or as I prefer to call it, the optimal airway pillow. First, let me give you a few facts that'll give you an idea how I, as a physician, have come to design these products for a better night's sleep. I suffered from neck pain myself, and I got to thinking, I wonder how many people do suffer from neck pain, and what could I do that would give us a better night's sleep? About 28% of men and 34% of women suffer from aggravating neck and upper back pain. Now that's about 1 out of 3 of us. And another thing I learned was we all have difficulty getting a good night's sleep. People are ingenious. They will take their pillow and they will punch it into shape, or they will double it, or they'll use 2 pillows, or they'll use their arm under their pillow before they go to sleep. Now you say, why do they do that? It's very simple. Your head weighs 10 to 14 pounds. How much is 10 to 14 pounds? Well, I happen to know that my bowling ball weighs 11 pounds. So the head being 10 to 14 pounds is very heavy, and it needs support. The second fact that's of interest is that people, our necks are gently curved. They're not straight. So a pillow should, 1, support the heavy head, and 2, support the gentle curve in your neck. Your neck's gently curved, it's not straight, so your pillow should support the curve of your neck. A pillow that's too high will straighten out your neck, and you'll tend to have your chin on your chest. A pillow that's too low lets your head fall back, and the result is muscle pain and stiffness. Your neck should be able to rest and relax all night long while you sleep. It shouldn't have to support the heavy head. Now, 1/3 fact before I show you the pillow. 55 to 70% of us spend at least part of the night sleeping on our sides. In other words, most of us like to sleep on our side. So the neck pillow, which I've designed, gives you a choice of levels. So you can sleep on your side, or you can sleep on your back if you prefer. Now, I'll get a neck pillow. Whoops. Okay. Now, this is the neck pillow, and I'm going to point out a few features for you. The neck pillow is unique. It has a unique surface of dozens of hills and valleys of what we call convoluted foam. These hills and valleys provide a pressure-free surface that's very good for your skin and your circulation. And they cover a multi-layer base that is contoured anatomically to support your head and neck at the correct levels. The 3 levels in the neck pillow are this. Here's the central groove down here, and you can see the pillow contours this through the central groove. Then you have, on one edge, you have a neck cradle. That cradles your neck. But remember what I said, that 50 to 70% of us prefer to sleep on our side at night. When you sleep on your side, you have more space between your shoulder and your head than when you sleep on your back. So the neck pillow has a 3rd high elevation that lets you sleep comfortably on your side. I'm going to demonstrate this to you. When you're sleeping on your side, the neck pillow absorbs sound, but it also takes up the space between your face and your shoulder and lets you sleep in alignment all night long. Now that simply means that your head is being supported correctly at the proper level, your neck is being supported correctly so it's in a straight line, and your neck and shoulder muscles are allowed to rest while you sleep. Again, as we know, many people tend to put their arm up underneath their pillows because their pillows bottom out. Ordinary pillows tend to soften, bottom out, and don't support the head. So you put up your arm, and what happens? You go to sleep, and you wake up, and your hand's asleep, and your arm's asleep. And how many times has that happened to you? With the neck pillow, you can support your neck, your head, at the proper levels so you get truly a good night's sleep. Now, I mentioned earlier I had a second pillow called the Silent Sleeper Anti-Snore Pillow. For the past several years, people have said to me, Dr. Dixon, can't you design a pillow that will help my husband stop snoring? I didn't think anything about it at first. But after about 3 years ago, I got to thinking, boy, I wonder if it would be possible to help reduce snoring in people. To make a long story short, I have learned and have designed a pillow that will let you breathe openly and clearly all night long and actually reduce snoring. Let me tell you again a couple facts about snoring and how I address this problem. I was surprised to read that 86% of men and 57% of women snore. I had no idea so many people snored. And many people complain bitterly, saying, my husband, my son-in-law, my uncle, my friend snore so loudly, I don't even want to be in the same house, much less the same room. I asked myself a couple questions. Why don't we snore when we are awake? What happens? We only snore when we're asleep, so something must happen between the time we're awake and the time we're asleep. Well, one thing that comes to mind is we change positions when we sleep. And we get in these sleeping positions that may narrow our breathing passages. The other thing to consider is, where is the snoring coming from? In other words, snoring can be caused at 3 levels. In your nose. Say you have polyps, a cold, hay fever, a deviated nasal septum. Those are temporary or surgically correctable problems. Some children even snore. That's a sign, oftentimes, that you should have them visit the doctor and check and see if their tonsils or adenoids should be removed. But most commonly, people tend to snore in what we call the hypopharynx, meaning at the low end of our throat, in back, where our tongue attaches to our mandible. My specialty happens to be anesthesiology. And from my years of experience as an anesthesiologist, I know that many of my patients will start to snore. I give them the sodium pentothal. I say count backwards, 99, 98, 97, and they will start to snore. And by a very simple positioning of their head and neck and their jaw, I can correct their posture so that they no longer snore. And this is the challenge that I faced and that I have designed the Silent Sleeper Pillow for. Now, the Silent Sleeper Pillow is designed with several things in mind. It has a cradle for your head, this is so that it can keep your head, whether you're lying on your side or whether you're lying on your back. It will cradle your head and stabilize your head. Remember I said earlier your head is very heavy. It is 10 to 14 pounds. And it rests in the head cradle. Now our sculptured Omalox neck bolster has a very interesting effect. And remember what I said about in the operating room, I will tend to bring a patient's jaw gently forward and clear their airway that way. The goal, of course, is to have completely unblocked breathing passages, and then you won't make a racket snoring when you sleep. So basically, if I could show you again, if I were lying on my side, discovered the optimal airway position would be a position where my head were slightly forward, my neck is slightly back, and my jaw is kept forward, but comfortably so. Let me show you the silent sleeper now. If I put my head in the head cradle, the neck bolster in my neck, I don't know, concavity, whatever you'd call the area between my head and shoulders, and then keep the top of the neck bolster holding my chin up. Now this position again keeps me in alignment, keeps my jaw forward, my head slightly back, and my breathing passages clear and aligned. The neck bolster is a very important part because it also supports the jaw. Now, snoring is caused by a blockage or a partial blockage somewhere in your airway. As I said, it can be from your nose to the back of your throat. Silent sleeper gets your head and neck and your jaw in a comfortable yet properly aligned position during normal sleep, whether you sleep on your side or on your back, to help reduce snoring. Thank you very much.